So one of the most common complaints of men with prostate cancer and their partner are the sexual side effects that occur after any kind of treatment. Men say that they want to talk about it, but often they don't. So how can you, as support group leaders, get men to talk? Well, the simple answer would be truth serum, but I don't think that's actually legal. So I'm going to try and give you a couple of pointers that may help you in your work in starting the conversation. So I think the first thing is to not be too personal in terms of saying to somebody, so, how's your sex life? People are not going to want to talk about it. If you talk about it in the context of relationships, I think that often is a helpful way of getting the conversation going. The obvious things like not asking closed answer questions, ask questions that have an open answer. How are things going for you? How have things changed? There's this weird thing that happens, I've observed, when why men don't talk to other men about sexual problems. And I think it goes back to the days when we were covered in hair and swinging from the trees. And there's a reason why erectile dysfunction is sometimes called impotence, because it speaks to lack of power, lack of virility, lack of strength, not being the alpha male. And let's face it, everybody wants to be the alpha male. Women want to be the alpha male too. So for a man to admit weakness in this area in his life can be really, really uncomfortable, to the point that men don't want to talk about it at all. So one of the things that you can actually do is to have a facilitator, a skilled facilitator for this kind of discussion. And I frankly would suggest that you actually get a woman to facilitate it. I have found that my gender has never been an issue in talking with my male patients, because I ask the kinds of questions that elicit responses, because I don't make assumptions. When two men talk to each other, the one may sort of phrase the questions in terms of how he functions, how he thinks, what he feels, what's going on in his relationship, in terms of how he views his own sexuality. And then that's going to elicit a similar kind of response in the other person. However, if you get a woman to facilitate this, hopefully, she actually won't start from any kind of assumption, because she's a woman and she doesn't have the same parts. And a woman will tend to ask more questions as well, because we don't make assumptions, because we don't know what it is to live in a male body. So I think that is perhaps one strategy that you can use. The other thing is that often you'll set up a session to say, we're specifically going to talk about this, and nobody shows up. People want to talk about it, but at the last minute, they just frankly chicken out. So perhaps to set it in the context of relationship changes, think about having a portion of the session with couples, and perhaps then after that split off into different groups, men together and women together can sometimes be helpful. Perhaps start with perhaps some assigned reading. For example, for my book, Prostate Cancer in the Man You Love, you can assign reading and have a discussion, almost like you'd have a book club. What did you think of this? The book is written in a way for a lay audience. It's not a medical textbook. And I tell stories about individuals and couples who have overcome these kinds of issues. So perhaps use one of the stories as an exemplar or a starting off point around what would you do in a similar position? What have you found helpful if you experience the same sort of things as the man or the woman in the story? So I think that might be useful. It's difficult to talk about. It's difficult to be vulnerable. And vulnerability is a key aspect of intimacy. And you're asking men in a public forum, even though those people might be trusted because they've been going to the same group, you're asking men in a trusted forum to, in a stressful situation in public, to talk about something that is extremely private. Men joke about sex all the time. They often don't talk seriously about it. So I think those are a couple of ways of dealing with it. I know that I'm invited to the prostate cancer support group where I live and work on a regular basis, and the room is always packed, in part because they've generally seen me talk before and they know how I talk about it. So I think sometimes actually having a guest speaker who's an expert in this area can also help, because it puts a little bit of a distance. And certainly there were questions from the audience today about this topic, because they were presented with information. It gave them a jumping off point or a starting point. And to admit that this is a difficult topic to talk about. As support group leaders, you may actually have to start the conversation by talking about yourself and what your experience has been, and perhaps the struggles you've had as well as the successes. Share resources of people who can help you. The other thing that Us Too has started doing is a Between the Sheets feature, and I have answered some questions from individuals who submitted questions, and I'm always willing to do that. So the staff at Us Too will pass those questions on to me, and I will respond in written format, and you can find that on the webpage or distributed with the paper newsletter. So that may also be another way of saying, hey, look, we've got this question that somebody submitted to the website. Let's talk about it. Has something like this happened to you? So those are some of the suggestions that